All right, everyone. I think this is like number 6 I've gotten in through today. So I just wanted to, again, thank you guys for watching me. I get a lot of good feedback from these videos I do. I'm gonna try to do some more in the operating setting after maybe a short day in surgery. That was one of my days today. So I'm gonna do as many because I'm way behind on questions. I get a lot of them. So the question today is about tanning. And the question is, when can I start tanning in a tanning bed or a spray tan after surgery? So there's two different types of tanning, right? So you have tanning in a tanning bed, which is, the UV light, same thing going outside. The problem is the scars. It's the scars, right? And the reason for that is that scars are very reactive to UV light. And whether you're outside or even worse in a tanning bed, it's very inflammatory. It causes the scars to get thicker. They cause them to get red and angry. And they start kind of regressing in how they're supposed to be looking. You actually make them worse if you continue to do so. So I always recommend my patients not having direct sun exposure to your scars, at least for the first 9 months. At about a year is pretty much done. Like, your scars are not going to change anymore, but the first 9 months are pretty important. And you keep them out of the sunlight, especially in tanning beds. If you absolutely insist on being outside enjoying life, which is fine. I'm okay with you being outside and enjoying the pool and stuff like that. Just make sure your scars are covered up with, your bikini or your swimwear or something like that, okay? You're tanning naked with your scars fully exposed, you're gonna ask for problems and how your scars will react, okay? If you're gonna be in a tanning bed and you insist on being in a tanning bed, then what I recommend is you could do some kind of occlusive tape. Electrical tape works great because it's basically, lights out black. There are some kind of stereo strips that you can get from pharmacy stores that also are 100% occlusive. And you'll have this little strip, basically not tan, so not the end of the world. But the first 9 months, again, I'm gonna tell you that the scars are very reactive to UV light, and I don't recommend that, okay? Spray tans are a little bit different. So spray tan is just really a pigment. You're just, staining your skin. I don't think that's really a big deal when it comes down to the scars itself. It's just a pigment. It washes off. It only lasts for, I don't know, maybe a week. So it doesn't have a really long-term effect. If you're gonna spray anything on your incisions, I would wait until 2 months after your surgery. Because again, I don't let my patients swim or, submerge your incisions in water for 2 months after surgery because you microscopically need it closed. So after that, you can put lotions on them and creams. That's when I start scar therapy, is 2 months from surgery. And the same thing for spray tan. You can spray tan it, not gonna be a big deal. It shouldn't be an issue. So spray tanning for me personally is a little bit better way to kind of get that more of a, sun-kissed glow skin color versus like tanning and outside. So I have to be the doctor and say, don't be outside, don't, wear your sunscreen, and take care of your skin. I have to be that guy, unfortunately, but I think just take everything in moderation in life. It's okay to be on the sun every once in a while. I don't think the sunlight's bad. But it's moderation. Just make it make sense. Don't go out there and get burned every day. That's just dumb. You will turn into leather if you're out in the sun every day and worship the sun. And never seen someone that worships sun for 20 years. I'm sure you won't just go out to the beach sometime and you'll find them who they are. But anyway, it's really about scar outcomes. I'm trying to give you better scar-looking scars. So please stay away from direct sunlight, tanning beds for at least the first 9 months after your surgery. And if you're gonna spray tan, it's 2 months. Hope to answer your question. Thanks for following, and I'll see y'all soon.